So today we're going to talk about resilience and grit. Does everyone recognize this character? Luke Skywalker, right? What about this one? Harry Potter. This is a little tougher. Imperator Furiosa, right, from Mad Max. And then finally, Dorothy. So what do these characters have in common? What sort of characters are they? They're heroes. They're all heroes. And today I'm going to talk about the kind of heroes we need in healthcare and what these heroes look like. When you read my novel, The End of Healing, I think you'll discover that they look a lot like you, like the people here. People, patients and healers with resilience and grit who have the passion and perseverance to stand up for true healing again and again and again in their daily practice. And you know, there's no better place than Memphis to talk about grit and resilience, the kind of grit and grind that it takes to change the status quo, that it takes to make a difference and tell an amazing story here in Memphis. So first, just to get started, I'd like everybody to stand up for a brief moment if they work in primary care. Fantastic. You know then how much we desperately need people to stand up for true healing, for primary and preventive care. But before diving into my protagonist story, Dr. Don Newman, a little bit, I want to give you a little background on journey stories like ours. As Carl Jung, Joseph Campbell, and Walt Disney Productions have all discovered, great stories, all great stories, involve hero journeys. And they all have several common characteristics, all these journey stories. First, they involve a journey into darkness, the deepest darkness that society has to offer. So I'll warn you, if you want to bring about real change in healthcare, we must journey into the dark underworld of the healthcare industry. Second, not only does the hero journey into the outer darkness of the world, discovering the darkness in our workaday world, but they also journey into their own inner darkness. And on that journey, we must confront our own darkness, the places where we fail our patients and ourselves, our families the most. And third, I want to remind you of a key characteristic of these heroes' journey stories that not too many people have talked about, but that's especially relevant for our discussion today. Heroes' journeys always involve a search for healing. If you think about Dorothy's story or Harry Potter's story, these are healing journeys, both healing for the broken world that the hero inhabits and for the hero himself or herself. So for those of you continuing day after day in the grit and grind of primary care, you know we're in need of healing, both for ourselves and our broken system. We perhaps need it more in healthcare than in any other sector of society. So let's begin that path. First, half of physicians are burnt out. They say they're unsure if they can continue in their current work. And it's worst in the primary care disciplines. 25% of residents are clinically depressed. And physicians are at double the rate of suicide of the general population. Why? What's the root cause of this deep misery amongst people who have arguably some of the best jobs in America, primary care providers? Is it because our healers are somehow weak or whine too much or lack resilience? No. Our healers are some of the best, right? It's because doctors and nurses know deep down that our system is broken and that each day in our working life we're complicit with this broken system, and it's painful. Let's talk about the depths of that deception that we're part of. American hospitals, where patients put their greatest faith for healing, their greatest hope for healing, we know now are among the most dangerous places in America. Every day, almost 2 747s full of people are killed inadvertently by medical mistakes in hospitals. Every year that amounts to about 250,000 people, though some say up to as many as 400,000 a year killed by medical mistakes in hospitals. And we used to think this wasn't true, but the studies are there now to confirm it. It really is true. This has made healthcare, the third leading cause of death. And yet we still all pretend that hospitals are the best place for healing. This problem is compounded by the incredible spending in healthcare today. We rely on an outmoded hospital-based rescue care system that waits until things have gone horribly wrong and then finally springs into action. We spend $2.7 trillion a year on this broken system, now more than $25,000 a year for the average family of 4, and over $50,000 a year for the average Medicare age family of 2. This is unsustainable. Our spending for American families is growing out of control, and we know most families can't afford this. Furthermore, our doctors and nurses know the truth that there's tremendous waste in healthcare through bureaucracy, through unwarranted use, or what we call unnecessary care. 1/3 of our healthcare spending, according to the GAO and according to firms like Thomson and Reuters, is wasted on unnecessary care. Just because we know this care is unnecessary means that it does more harm than good. Do we feel like the healthcare of today is just? Is it fair? Is it efficient? No. We know how to do better, and our families, friends, and neighbors are suffering the consequences. When I decided to write a story to point the way out of the underworld of modern medicine, I couldn't imagine any better model than the Inferno of Dante Alighieri. Dante's story begins, "Nel mezzo del cammin di nostra vita, mi retrovai per una selva oscura, che la dritta via era smarrita." In the middle of the way of our life, I found myself in a dark wood where the straight way was lost. I think most of us in healthcare have been there at one point or another. Similarly, Dr. Don Newman's awakening happens in the middle of the night on call when he's called by a nurse to the bedside of a woman who's experienced a massive stroke and has no real chance of significant recovery. And there he feels forced to put in a large IV, a central line, that he feels certain she would refuse if she could speak up and voice her wishes. As he stabs her neck with the IV, a voice in his head whispers the oath he had taken at the beginning and again at the end of medical school. "And at least I will do no harm." Bullshit. Harm is my business. How could any good ever come from what I'm doing here to Miss Bellamy? Then he's faced with a choice. Like Neo is asked by Morpheus in the Matrix, a question like I'm asking you today, whether you'll stand up against the status quo for something different, for something better. When Don meets his mentor, Dr. Gil Sampson, to learn about the Ivy League graduate program in health system science that Dr. Sampson leads. Sampson tells him, "Our fellows train to become agents for healthcare change. They study how health systems function and analyze the root problems in American medicine. I'm looking for a doctor who wants to take on the status quo, the doctor for whom making money isn't the first concern, a doctor who wants the healthcare business focused on the patient instead of the paperwork, a doctor burning with desire to bring true healing to the American people." You know, it's not easy for a young doctor to choose this path of change with greater than $200,000 in debt on average and so many more lucrative options than primary care, working for the system as usual, doing business as usual. Dr. Sampson admits as much to his young mentoree, telling Don how lucky he would be to join his program. He says, "Plus, you'll earn a degree in public health, the one degree that's guaranteed to lower your starting income." Then Dr. Sampson asked Don the same question I'm asking you. "Listen, you've got a choice. You can go back to the wards, try to forget this little conversation, and work for the medical system as it is. Or you can follow me to the bottom of the rabbit hole. If you come to Florence College, all I can promise you is the truth. No salary guarantee, no fancy car. My program isn't easy, and only time will tell where it will lead you. But you'll learn the truth about the healthcare industry, and you might find yourself in a position to help change things for the better. So the choice is yours. What are you going to do?" Do we have the courage to face the full truth? It's hard to look at these issues in our daily life and practice and in our profession. Do we have the resilience and grit to take the hero's path with Don to stand up and demand better care? If you do, let me give you a clue as to where that path might lead. As Dr. Sampson says in the first of his health systems seminars to his young graduate students, if you want to understand the truth about American healthcare, follow the money. Follow the money. If you travel with Don and you follow the money, you'll discover what many of our most profitable healthcare companies don't want you to know. As Dr. White, another one of Don's mentors, tells Don, payment has nothing to do with quality of care or results. So it's not whether you kill or cure, it's how you code the claim. In fact, you know that hospitals make more when they make mistakes. They still do. Doctors make more when they rush in and do a shoddy job. And insurers make more when they deny needed care. Using Dante's Inferno as a guide, as a secret key that unlocks the hidden secrets of the healthcare business, Don journeys through the underworld of the healthcare industry, and he discovers that for every ethical misstep that Dante details in his Inferno, starting with mistakes of incontinence or indulgence, moving to mistakes of violence, and then into the worst kinds of mistakes of all in his conception, mistakes of fraud and deception. Don finds all those things in the healthcare industry, and he realizes that Dante's Inferno provides the perfect ethical framework for us to understand the healthcare industry we're part of. Using Botticelli's magnificent drawings of the Inferno and what he learns from his study of epidemiology, biostatistics, and health economics in his Ivy League graduate program, Don doodles a parallel drawing to Botticelli's drawing in the back of his journal. And there it is, detailing the money spent in each sector of American healthcare, the lives saved and the lives lost. And what he discovers is that where we spend the least dollars on outpatient and primary care, we get the most in terms of lives saved, by far. And where we spend the most, we get the least in terms of life saving in the realm of hospital care and hyped care. The world of healthcare is upside down. So like Don, we have to begin to ask whether the time for this outmoded system of so-called healing has come to an end. When we realize, as Don does, in 2001, oh my God, for the money spent on fraud and high profits in healthcare, Americans could hire 10 million teachers. Which would do more good, maintaining exorbitant profits for powerful healthcare companies, or teaching 70 million children how to improve their own health? As Don discovers, we can stand up and demand something better and get true high-value health care for ourselves and our families. This is the kind of grit and resilience we need, I think. Not merely to grind along in a misguided game plan year after year, but to learn from our mistakes. In fact, rather to hold up and expose our mistakes so that we can fix them. Resilience, grit, and determination to stand up for system change, to stand up for reform of the most dysfunctional of our titan industries that currently dominate and often corrupt our day-to-day work environment. But to do that, you have to know the truth. You have to walk along with Don on the hero's path to understand what we truly need from our healthcare systems and from our healers. We have to look and hear the stories of people like us, patients and primary care and other physicians and nurses and other types of healers, to find what true healing looks like in the real world. So, what can we do? We've talked about admitting that the problem isn't about just managing disease, but it's about managing money. And all that really needs to be done is move this misspent money over here, where it can do some good, right? It sounds pretty simple. And it is at one level. The only problem is that all this misspent money is some industries' ill-begotten profits that they're fairly fond of. So I think exposing the truth about where we spend our money is part of the key. So real system transformation will require grit and determination. So what can we do? Where can we start to put primary care and prevention and public health first? One, make health care accountable. Every American needs to know how much they're spending on health care, where they're spending it, who is getting the money. At a minimum, every service ought to result in a bill that's easily understandable and makes clear who is getting paid for what, including administrative overhead. Second, I think we need to invest in new models of care. We must pay for primary care-based population health and prevention first. And that means things like investing in scribes and medical assistants and begin collaborative documentation in every clinic so that we stop making doctors and nurses into typists. Patients can find ready partners, I think, with you, in primary care clinics to strengthen primary and preventive care in every neighborhood. Third, I think we really have to work to flip the system completely upside down. What does that mean? It means flipping the system to emphasize prevention, chronic disease management, and primary care and community settings rather than hospital-based rescue care. As Maureen Bisignano eloquently has said, flipping healthcare means flipping the balance of care from the hospital to the community. That means putting patients in charge of their health rather than insurance companies. And what this ultimately means is replacing hospitals with clinics, expensive emergency rooms and emergency care visits with home visits, nursing homes, replacing nursing homes with home care. And we have to stand up and reform the industries and policies that are dominating every clinic encounter in our daily work life. That means moving to comprehensive care payments for primary care so that the medical record is devoted to what's needed for patient health, not to what's needed for insurance company billing. To truly flip the system will require radical improvements and access to primary and preventive care in every community. Neighborhoods will have primary care clinics within walking distance. Clinics will routinely offer expanded hours and home visits, as well as accessible electronic and phone communication. And every clinic will extend its connections into the community, offering ready access to mental health services, health coaches, diabetes education, fitness and nutrition support. What patients want is a deep relationship with a healer. This is the foundation on which we need to build healthcare. It will take knowledge, resilience, grit, and determination to rebuild healthcare on this ancient, proven foundation. We primary care workers, policymakers, educators, regional health improvement collaboratives, and most importantly, patients themselves must stand up for healthcare that heals if we expect to find it for ourselves, our families, and our loved ones when we need it. And to stand up for better healthcare, I think you'll find it helpful to read The End of Healing. Thank you very much.